Kia ora koutou and welcome to Goodfellow Podcasts. This episode is supported by the Goodfellow Unit. I'm Dr. Louise Kugler, a GP specialist, and today I welcome Professor Wayne Cutfield to the podcast. Today we're delving into the fascinating area of the gut microbiome. Wayne is a professor of paediatric endocrinology at the Liggins Institute, the University of Auckland, and is a key member of the paediatric endocrinology team at Starship Hospital, where he established Auckland's regional paediatric endocrinology service. With over 320 publications in high-impact journals, he is a leading figure in paediatric endocrinology. Wayne has received multiple honours, including the Peter Gluckman Medal and the Howard Williams Medal for his contributions to child health research. Wayne co-leads the Gut Bugs Research Group, which explores the gut's microbiome's impact on conditions like obesity, autism, metabolic disorders, and C.difficile. Kia ora, Wayne, and welcome to the podcast.
Kia ora, Louise.
So in this episode, we're talking about the gut microbiome, what it is and how it influences our overall health. So I wonder, Wayne, can you start by just explaining what the microbiome is and why it is important?
The gut microbiome is one of the most fascinating new frontiers of biomedical research. If you go back 15 years ago, we thought our gut microbiome were a bunch of bacteria residing in our gut that were like squatters that didn't pay any rent. We were the hosts, didn't do anything for us or to us, they were just there. And then a whole bunch of really important landmark experiments were conducted in this little mouse called a germ-free mouse. And the mouse had no gut bacteria. So any gut bacteria you put inside it, change in phenotype was due to the gut bacteria. And what we learned was that if you put in the microbiome of a fat person, human, into this germ-free mouse, it became fat. And similarly, if that mouse became fat and then you put in a thin person's microbiome, the mouse became thin. And since then, we've learned that the gut microbiome influences a wide range of our health and well-being dimensions, from metabolic health to immune health to even mental health and behavior. All told, our gut microbiome in total, there are 10 times as many bacteria as cells in our body. And if you actually put them all together and weighed them, they're about close to 3 kilograms. Next time you weigh yourself, take 3 kilograms off the scales and just dial it back 3 kilograms. So yes, it's believed to be important based on a whole lot of animal studies and association studies. And we'll come back to the association studies later.
So Wayne, what constitutes a healthy gut microbiome and what are the key features a healthy microbiome should have?
We believe that a healthy microbiome needs to be one with enormous diversity. And it's thought that that will create the most robust and healthy microbiome. And if you think of an analogy of, say, a single species forest, like a pine forest, that's going to be less resilient to external adverse factors than, say, a tropical rainforest, in which with environmental factors changing, ultimately the whole forest will be more resilient than, say, a single species forest. So we think diversity is important. But even defining that diversity and the range of bacteria is still a voyage on discovery. In other words, we're still trying to define what is an optimal microbiome. So an optimal microbiome for you, Louise, or for me, may be different. It may not be the same. It may be subtly different.
So if we're wanting to improve or support a healthy and diverse microbiome, what things can we do?
Well, this all sounds a wee bit like motherhood and apple pie, and it's the sort of thing that you would advise any of your patients who are asking about what is a healthy diet or healthy lifestyle. And the answer is basically a healthy diet that is not too high in calories, in other words, an appropriate calorie diet that's not too high in fat, not too high in salt and sugar and refined carbohydrate. And of course, it's salt, fat, sugar, refined carbohydrate that gives our diet flavor and texture. And of course, more fiber in our diets. In addition to that, antibiotics are very disruptive to our microbiome, so judicious use of antibiotics. Exercise clearly helps your microbiome and may improve its diversity. And of course, other parameters like stress and those other extraneous factors can also influence your microbiome. It's very sensitive to your biological state being unbalanced, and it will respond like you to that.
So, if we have an unhealthy microbiome, how would an individual know that things are out of balance?
That's a good question. And the answer is we don't usually know that it is out of balance. I mean, the extreme example of that would be C. difficile infection, where you have a very disrupted dysbiotic microbiome because you've got overgrowth of C. difficile producing toxin. There you have florid symptoms, abdominal pain, diarrhea, and so on. Otherwise, for the rest of us, it's not obvious that our microbiome is dysbiotic. It's not going to lead, and you may read that a dysbiotic gut microbiome may lead to gut symptoms, change in your bowel habits, abdominal pain, tiredness, But in reality, you don't really know that, although a dysbiotic, unbalanced gut microbiome may actually be contributing to your health or ill health. In other words, it could be contributing to poorer metabolic health, higher glucoses, increased fat mass. It's pro-inflammatory. It may adversely affect your immune system, for example, and increase the risk potentially of immunological disorders and possibly even infections. And it may affect your behavior adversely as well. So it may not be obvious that it's contributing to those things, but it could be. So it's not obvious when the microbiome is dysbiotic to an individual.
Fantastic, thank you. So are there specific health conditions that we could identify, or we just don't know at this point? You've mentioned C. diff, for example.
There are a long list, and the list grows longer every day, of conditions, and these are common non-communicable diseases in which there is gut microbiome dysbiosis. And these include obesity, type 2 diabetes, allergic diseases like asthma and eczema, inflammatory bowel disease, irritable bowel syndrome, autism, anorexia nervosa, Alzheimer's, Parkinson's disease, and the list just goes on. And these have been shown in association studies. But we know that association doesn't prove cause and effect. And the thing that still needs to be unraveled is, what is the contribution of the gut microbiome to these conditions? Or is it just that in these conditions, there are other changes to that person's health and well-being and lifestyle that the microbiome changes? So it's a sort of a byproduct of the condition. And if it is contributing to the condition, it's unlikely that it is the major cause of any of these disorders, but it may well turn out to contribute components of the underlying condition. And really, to better understand that, we need to move into the world, which is happening, of clinical trials. And there's sort of interesting bits of data evolving around the impact of the microbiome by creating a healthier microbiome in these conditions. So this is now the era of clinical trials and trying to understand the impact of having a healthier microbiome in these conditions.
So tell us about testing. Is there a role for testing? And if so, what and how do we test?
My advice in clinical practice is don't do it. At the moment, microbiome assessment and management is very much in the research world until it's really clear what needs to be addressed in the microbiome and how that's done. Now, you can dial up, and you'll see them online, a range of companies offering to characterize your microbiome. And it doesn't come free. It's anywhere between $400 to well over $1,000. The problem is that they'll give you this report, but we actually don't know for that individual what is the right or an appropriate microbiome. And sometimes this report will come with some generic advice about improving your lifestyle, which you would give to any of your patients without the report. So I don't think that I would recommend doing that kind of testing. And if your patients ask you about it, indicate to them that while they have this information, we don't know how to use that information. And so when we don't know how to use it and what it could mean and what to do with it, don't measure it.
Wayne, often in primary care, we're faced with other practitioners ordering these sorts of tests, and then our patients turn up with a piece of paper in hand asking for a specific antibiotic or treatment to improve their microbiome. So your advice there would be, hold off and perhaps look at all the other things like diet, exercise, and stress rather than writing out a prescription for a particular antibiotic?
Yeah, exactly, Louise. I wouldn't respond to the report because, as I mentioned, it's not possible to determine what is the ideal microbiome for that person. So a report saying there's a bit more of that or a bit less of this bacteria, what does that mean to that individual? And if you slightly tweaked it, will it make a difference? And until you conduct clinical trials to actually test that, we actually don't know. Now, in a clinical trial setting, we do characterize a person's gut microbiome in a lot more detail than is done in these tests that you can buy. We sequence the entire genome of every bacteria. It's a phenomenal amount of information and more than is generated by these tests. But we're comparing a change in microbiome and microbiome between individuals in terms of understanding how things change for groups and not down to an individual level. We're not using it to manage an individual. We're looking at to compare groups and how groups change over time. So coming back to your question, I would hold off implementing any changes based on that report. Now, the exception to that might be if there's a little comment that says C.difficile toxin positive, then you need to respond to that. But other than identifying pathogens, and our gut microbiome are not pathogens. They consider them as commensal organisms. They're not pathogens. But if there was a pathogen present, then that needs to be managed.
Do we know about specific roles? You've mentioned diet, exercise, and stress management.
Antibiotics, alcohol in moderation.
Yeah. So what advice are we giving? Is it more plant-based diet? Is it a varied diet, unrefined diet? What specific advice should we be giving?
The sort of gold standard diet that is talked about in terms of how we compare a Western diet. And a Western diet, as I mentioned, is higher in calories, higher in fat, higher in refined carbohydrates, salt, sugar, is the sort of hunter-gatherer diet, which tends to be low in calories, very high in fiber, low in fat, low in sugar, low in salt, and limited meat intake. So it's really moderating the refined pieces of our diet. As I mentioned, it's calories, fat, sugar, salt. Moderating that, asking patients to remove them is just illogical because it's unpalatable. For the hunter-gatherers, they don't have a choice. That's all they've got available. They can't go to a supermarket like we can and just pull things off the shelves that we like the look of and the taste of. We have a lot more selection and they have limited or almost no selection. So really it's the kind of typical healthy diet and lifestyle recommendations that you would normally give for anybody. And if you think about it, your microbiome in essence is part of you in that whatever you eat is feeding you and your microbiome. And how you feel and how you respond, your microbiome is going to respond as well. And if you take medications, antibiotics are a good case in point, it's really going to mess around with your microbiome. And it takes weeks, months, and sometimes longer for it to recover. And it may not fully recover from a course of antibiotics, particularly when broad-spectrum antibiotics are used. One of the difficulties we face is that when choosing antibiotics, you want to have a bob each way and cover a range of potential different organisms. And so we tend to slip towards using broader spectrum antibiotics. So if a broad spectrum antibiotic is going to cover a bigger range of pathogenic bacteria, suffice to say, it's going to have a bigger impact on your commensal good bacteria. And so they tend to have a more nuking effect, if you like, on the gut microbiome, broad spectrum antibiotics. So penicillin, narrow spectrum, augmentin, broad spectrum, cephalosporins, broad spectrum. So it's just a matter of being cognizant of the impact that the antibiotics you choose have on the patient, the infection, but also the microbiome.
Just picking up on antibiotic use, Wayne. So, there's a lot of push once again for probiotics to follow alongside antibiotics and for some weeks after. Is there any data that actually shows benefit of that? And if so, what should we be suggesting?
That's a good question. And there has been quite a big push to use probiotics with antibiotics, particularly in children. And the gut microbiome between birth, when there's very little gut bacteria, to about 2 to 3 years of age, the microbiome develops and becomes almost more adult-like by about 3 from being almost non-existent. So that's potentially a vulnerable period as the microbiome's developed. So there has been quite a lot of recommendation to consider probiotics either with or following antibiotics. Now, there was a really interesting editorial written quite recently in Lancet, and it looked at trials in which probiotics had been used. And this is looking across a range of studies in leading journals, including the New England Journal of Medicine. And not only did it not improve recovery from infection, but in fact, it could actually make things worse. And if you look at the microbiome, when you give a probiotic, it contains one or at best several bacteria. Now, when they're swallowed, there's a high risk that many of the bacteria may be dead from the get-go. And when they're swallowed, a lot of them get killed in the stomach. So the potential effect is somewhat limited. But if they do get established in the bowel, there's a risk that that particular bacteria will overgrow and turn an unbalanced microbiome into an even more unbalanced microbiome. So there are a couple of studies to suggest that probiotics with antibiotics may actually make things worse rather than better. So while it seems like a commonsensical thing to do, there is no evidence that in fact it is useful and it could potentially make things worse. Now, that's probiotics. Now, what about prebiotics? In other words, basically foods for the bacteria to try and stimulate the redevelopment of a healthy microbiome. That's greyer still in terms of effect. So we don't really know whether prebiotics could help. But certainly I wouldn't, currently on current evidence, I wouldn't recommend probiotics following antibiotics.
Fantastic. Thank you for clarifying that. Wayne, I wonder if you can tell us about the role of fecal microbiota transplants. What's happening in the space? Are they something that we should be considering with our patients? And what do we need to know?
It is in the research stage, other than for C. difficile infection. We'll come back to that in a minute because that's becoming the second-line therapy for effective cure of C. difficile infection. And one day it could be first-line therapy. But firstly, it's complex and expensive therapy, and it's a bit clunky at the moment. So we take the microbiome from a healthy donor, and in our trials, and we have a whole bunch of parallel trials we're doing, we will use the microbiome from 4 donors for each recipient to try and maximize diversity by increasing the number of donors. And there's some evidence that that could be helpful by having multiple donors. To get 8 donors in the go position, we screen more than 100 potentially eligible donors, because we need to be absolutely certain that donors will not be transmitting hidden pathogens for which they're asymptomatic, or a medical problem that they may have or they could harbour based on family history. And so getting the donors sorted out is quite a problematic, clunky issue. Having said that, what we do know, and with our treatment trials, we've taken, and this is where you need to be listening to this podcast after lunch or after dinner or after breakfast, is that where do we get the microbiome? We get it from a donor stool, a fresh donor stool. And the early trials, they basically took that donor stool, put it in a blender, put a nasojejunal tube down or a colonoscope up, and just poured it in. Sounds horrendous, but in the early trials, some of the benefits they saw were with those tools. We have now discovered a much better method in which we take a donor stool, pull out the bacteria, clean them all up, put them in a capsule, put them in a second capsule, you swallow them, they're tasteless, odorless, and they're released in the small bowel to be effective in the small and large bowel. Now, we've shown after a single treatment in a very obese group, morbidly obese group of teenagers, and these are RCTs I'm talking about, that one treatment, half on one day, half on another day, 4.5 years later after that one treatment, the treated group were 11 kilos lighter than the untreated group, 8 centimetres less waist circumference, and their metabolic syndrome score, which is a way of continuously measuring your metabolic syndrome risk, was 3.5-fold lower, which suggests that it might be well protected for metabolic syndrome and potentially type 2 diabetes. So that was after one treatment 4.5 years later. So that's quite promising. And clearly there's more work to be done in that obesity, metabolic syndrome, type 2 diabetes space, but there is some promise. We've just completed a trial in autism to see if it improves gut health and anxiety. We've just completed a pilot trial in anorexia nervosa, and one of the early findings that we identified was a reduction in anxiety, which is a big feature of anorexia nervosa with FMT, and we need to explore that a bit more. And of course, with C.difficile, which is a trial that's currently underway, and if you're Auckland-based and you have a patient with C. diff, please look at the bottom of your Awanui Labs result and give us a call, because we're recruiting patients into our C. diff trial, where they get vancomycin with or without FMT. And if indeed it is effective, my hope is that, in fact, for patients with C. diff, the first line of treatment will become FMT, and that will be done in 48 hours. You don't have 10 days of antibiotic metronidazole, which is all that's available, that fails, and then the patient gets another course and another course. And I saw a trial patient today who had a root canal abscess, treated with 7 days of very broad spectrum antibiotics, cured the root canal abscess. She was a completely healthy, well woman who developed C. difficile, and she developed recurrence almost straight away after she stopped the metronidazole, and that has gone on about 5 times over 2 months, and she cannot get free of C. difficile. So here's an example where what you would think was a relatively minor event, this broad spectrum course of antibiotics, set this woman up. So these are important trials to do to demonstrate the potential benefits of FMT across a range of conditions. And in all of those other disorders I mentioned earlier, trials need to be done to work out, is this an effective form of therapy, a healthier microbiome, and does a dysbiotic microbiome contribute to these conditions? Because for many of them we don't know. There's been so much promise of the gut microbiome. Let's test it and understand that.
Fantastic. Thank you, Wayne. Another area that often comes up a lot is the gut-brain axis. I wonder what we need to know about this area.
We know there is a connection between the gut and the brain, and in part that's mediated by our gut bacteria. So our gut bacteria can directly influence our bowel and create a leakier gut and gut health, but our gut bacteria release products that get into the circulation. And before they reach the brain, they can be pro-inflammatory, obesogenic, they can increase adipocyte development, they can affect immune function, but they also signal in the hypothalamus, and they appear to influence appetite regulation and food control, and even behavior, impulsivity, anxiety. There was a very interesting study to just parallel that, in which they took our germ-free mouse, the mouse with no gut bacteria, and they put the microbiome from a young woman with anorexia nervosa into the mouse. And the mouse very quickly started eating less, and food intake went down. And for the given food intake, the mouse was still losing weight. And then the mouse became progressively more and more and more anxious and displayed almost an anorexia nervosa phenotype. And that just tells you potentially how powerful that link can be. And facetiously, I make a comment that when you go to the coffee shop and you order the donut, who made the call? Did you think you were calling it, or your gut bacteria saying, I need a donut, and told your hypothalamus? That's being a bit facetious, but the impact of our microbiome extends beyond our gut and our immune system and metabolic function, and it influences our brain and behavior. Now, how much it does that becomes clearer when we do trials like in autism and anorexia nervosa, and trials are almost certainly going to be done in degenerative disorders like Alzheimer's and Parkinson's disease, but even in anxiety. And we are currently considering a trial in severely anxious patients to see whether it may actually help in those people.
Wayne, thank you for all of this. Where do you anticipate gut microbiome research will go over the next few years? Where are you heading?
Where we want to head, and we're doing this work in parallel, is I mentioned the FMTs currently are a proof of concept to demonstrate that gut microbiota can help your various aspects of your health or ill health. Once that's demonstrated, what we are also trying to characterize, are there certain players in your gut microbiome, certain bacteria that are particularly helpful? In other words, is there a portfolio of them rather than your whole 5,000 species of microbiome, of gut bacteria, that might give you the benefits. And it might be different bacteria depending upon the condition and what you're trying to achieve. And if we can identify those bacteria, then what we're going to do is pluck them out, isolate them, grow them up, and then create what I call a bespoke super probiotic and put them in a capsule and another capsule, and they could be swallowed, which is a whole lot easier and easier to scale than say, I'm developing diabetes or I've got metabolic syndrome, I need an FMT. Getting that organized is actually quite a clunky, complicated, and very expensive exercise. Whereas to scale up the treatment from cultured key bacteria is going to be a whole lot more effective. So that's where we're heading, and there's quite a lot of biotech company and pharmaceutical company interest in this field because they can see it as very opportunistic to add to standard pharmaceutical and other nutritional interventions.
So fascinating. Wayne, to conclude our podcast today, your take-home messages, please, for our listeners.
I would say, remember that your gut microbiome is part of you, and things that you do to yourself, you will also be doing to your gut microbiome. And what you eat, you are sharing with your gut microbiome. So be aware of it, but don't be dominated by your microbiome and that you need to do specifically this for this bacteria. Basically, the kind of advice you normally give your patients is going to help your microbiome, and that is healthy lifestyle, healthy diet, a prudent diet with high fiber, rich in leafy green vegetables, and regular exercise will help your gut microbiome, your gut health, and it'll help you.
Wonderful. Thank you so much. If you're a New Zealand GP and would like to claim CPD points for listening to this podcast, our podcasts are eligible, so please log them. You'll also find a list of resources used in this podcast, including a link to the gut bugs trial on our website, goodfellowunit.org. If you'd like to get in touch, please email me at podcast@goodfellowunit.org. Thank you for listening.